Are you struggling with shoulder pain and stiffness and wondering if it might be frozen shoulder? Here's the truth. Not all shoulder pain is frozen shoulder, and getting the wrong diagnosis can waste months of your time. In today's video, I'll show you key signs that tells us it really could be frozen shoulder and share proven treatments like self-joint mobilizations and shockwave therapy that can speed up the recovery. Frozen shoulder is also known as adhesive capsulitis. It occurs when the capsule around the joint becomes inflamed and tightens. It affects more women than men, but most often between the ages of 40 and 60. Metabolic health also plays a major role as well. Conditions like diabetes, high blood pressure, blood sugar, elevated lipids significantly increase the risk and likely contributing to the inflammation and tissue changes in the shoulder. As the capsule thickens and stiffens, motion becomes restricted and pain increases. Frozen shoulder usually progresses through 3 stages. The first stage is painful, the frozen stage, and then you finally have the thawing phase. The good news is most can resolve on their own. The bad news is it can take up to 2 to 3 years without the right care. But there are things that you can do to speed this up significantly. So in order to have frozen shoulder, you have to have a capsular pattern. That's what's really significant, that really goes, okay, if you have a capsular pattern, more than likely you have frozen shoulder. We've done other videos explaining what are some things that can mimic a frozen shoulder, but that's not what we're gonna talk about today. We're gonna talk about frozen shoulder and what you can do about it. So what is a capsular pattern? The capsule goes around the joint and tightens it up. And there's like adhesions, that's why it's called adhesive capsulitis, because you get adhesions that really lock down that joint. Now the capsular pattern is external rotation, so the worst motion is external rotation. So that's moving the shoulder out. And so this is going to be the worst motion, followed by abduction, followed by bringing the arm up. Literally you'll get through here and then you'll just start compensating. You get really stuck where that ball of that shoulder can't come down. It gets stuck at the top of that shoulder, and we're going to talk about how you can fix that later. The next motion that is limited is internal rotation, so that's bringing the arm in, and then the next one is followed by flexion, so bringing the arm straight up. So that's the best is flexion, and then, you know, the next best is internal, so if you go backwards that way, but yeah, the worst is external rotation, abduction, followed by internal rotation, followed by flexion. So that's the capsular pattern. So when you notice that by checking your motion, and that kind of sounds like me, then we know that we need to start working on improving that joint mobility, because the joint is just so stuck. One other thing that's another piece to it, I know internal rotation is the third easiest to do, but functional internal rotation is horrible. This is the last to come with anyone that we have frozen shoulder. We don't even work on this because it just takes longer to get. Even if you have external rotation, functional internal rotation is usually the last that comes of our clients, and the last thing that we really focus on. So when we have someone that has this, our goal is to make you as functional as possible. Reduce that pain that you're getting, but also improve the function. And so most of the time, if we can reach through this plane, that's going to help us the most. So those are usually some of the motions that we want to get. What tends to happen the most is literally like we can't get the shoulder to come any higher than this because it's so tight at the top part of this that we can't get that shoulder to get down. So we're going to work on things that's going to help us stretch the joint up. We're also going to do things that's going to help stretch the joint down. If we can get this motion a little bit better going up and down, this is going to be better because when you raise the arm up, that joint has to go down. Same thing with the outside. If we can improve some of this and the motion, these other motions will start coming. And so that's what we're going to show you on how to do that. So the first thing we're going to show you is the self-joint mobs. So one that we like to do is, again, we want to stretch that joint going down. So you can use a bag, just like this, and you can start adding weights in. So you'll probably have to add, everyone's going to be a little bit different on what they can tolerate. So these are like 1 pound weights, and I would just start adding 1 pound and then another pound and then another pound and just kind of see how it is. But what we're going to do is we're going to sit And we want to bring the arm to where you almost kind of feel it. So if you can feel it resting here, great. We're going to start there. If we need to go a little bit higher to feel it, then we want to put something underneath this part of the arm to go a little bit higher to where you're like, yep, that's where I can't really go any higher. I feel a little bit of a stretch. What you're going to do is you're going to use this bag, and you're going to put the bag on the shoulder to where you can even use like your hand. If you want to, you can use the weights. But if you need to like keep it, it feels like it's sliding down, you're going to put it at the top part of that joint, like where it gets stuck, like right on the meaty part of it, not at the very, very top, the meaty part of the shoulder, because we want to take that ball of that head and push it down. And so you can use your hand to kind of help push it down. You can use weights to push it down, but we're just basically kind of giving us a mobilization to move that arm down. And again, we're just trying to stretch the joint to give us more flexibility to start opening the range up again. And so this is one stretch that you can do. The next stretch that you can do that we give people is we'll have them lie on their stomach, and they'll be in through here. And so what we're going to do, instead of like stretching the ball down like this, we're actually going to stretch it up. So we can, again, get more room. So you'll have your elbows underneath you, and then you'll just sink down, just moving the arms where that joint is, like you're stretching the ball, the joint straight up as you come down like this. Now, you can angle things out too. It changes the angle. You're just gonna have to see what's gonna work for you, and you just kind of breathe and hold it. We're just, again, stretching the joint to make it like give us a little bit more space. Now, when you're stretching something, you really want to keep it there for a good minute or so to really give that good stretch. And you're going to want to do these 2 to 3 times a day. And so those are 2 stretches that are great. Another one, this one's harder to do for most people because most people with frozen shoulder, they can't get their arms back like this. So you'll have to almost have them closer to your body. You're going to do the same thing. You're going to sink down and stretch the joint up. So you'll literally just kind of stretch it and hold it in this position. Like I said, around a minute or so, doing it 2 to 3 times a day. You can do the same thing with the arms out a little bit. It just changes the angle a little bit to where you can kind of stretch in through there. So those are 3 great stretches that will definitely help improve your mobility. It is going to take time. It's just one of those things. But if you want to do something that's going to speed up time, this is where Shockwave comes into play. And when you do Shockwave on a frozen shoulder, you're literally doing it where you feel the tightness and the pain in that capsule. If you want to knock out that pain, you're going to knock it out really fast. And again, with Shockwave, what it does is it will knock out any scarring, adhesions, calcification. Well, guess what frozen shoulder is? It's adhesive capsulitis. It has adhesions. So you're literally doing Shockwave around the shoulder, around where those adhesions are, to improve that mobility. And when we do Shockwave, we're literally taking them to emotion to do it and then hitting those spots as we're even doing it, actively moving it. We can do Shockwave where we're actively kind of moving it, taking them to end range, feeling where they're feeling some of the tightness or the pain, and we take the Shockwave unit and hit it that way. So there's a lot of different ways that we use it to really free up that shoulder, and you can significantly improve not only the pain, but the function when you use Shockwave, better than just doing therapy alone, hands down. Never seen anything like that really can help improve your range of motion significantly. So give those exercises a try and comment in the comment section on how they're working. If you're dealing with frozen shoulder or think you might be, don't wait for months or years. At mPower Physical Therapy, we've helped many people recover faster with the right diagnosis, specific exercises, and regenerative Shockwave therapy. If you want to learn more, check out the link in the description to sign up for a free discovery visit to answer your questions, learn more about your story, and see if we are the right fit for you. And don't forget to like, subscribe, and share this video with someone struggling with shoulder pain. It could save them months of frustration.